37 million people across the United States and 14,000 people in the Rockford area suffer from chronic sinusitis. It's a debilitating condition that leaves patients with sinus pressure and pain around the face, nasal area, and eyes, headaches, thick postnasal drainage, clogged airways, fatigue, cough, dental discomfort, and ear pain. Hi, I'm Yvonne Woloshin with Rockford Health Physicians. In this video, you will learn about sinus infections, conventional therapy, and a newer treatment option called Balloon Sinuplasty, a minimally invasive, clinically proven, safe, and effective system to relieve your sinus discomfort. Just when do your sinuses become infected? Dr. Fazlur Zahurullah, an ear, nose, and throat specialist with Rockford Health Physicians, explains.
Sinuses get inflamed when they get blocked. And so normally they have a wet lining, just like the inside of the nose and the throat. And normally that wet lining makes mucus, just like the nose and the throat does. If the sinus is open, then the drainage that's made by the sinuses can drain out through the nose, through the opening. If it gets blocked, however, that drainage has nowhere to go. It stays stagnant and can get infected.
Knowing how long your symptoms last can help you and your doctor determine if you have an acute or chronic sinusitis and the appropriate course of treatment.
Acute sinusitis is somebody that's had sinus infections for 4 weeks or less, and chronic sinusitis is a condition in which someone has had sinus infections for more than 12 weeks. So the timing is important, but it also has an important implication for the doctors that are treating it. Usually patients that have acute sinusitis have a different set of bacteria that causes those and respond better to antibiotics and medical treatment. The patients that have had the sinus infections for 3 weeks or 3 months or longer tend to have chronic sinusitis. They have different bacteria and they tend to not respond to medications. So a lot of times, as much as we'd like to make them better with an antibiotic or nasal spray, they don't get better, and then they need a surgery to open up their sinuses.
Treatment options for sinus infections vary, depending on your diagnosis. If you're experiencing initial pain and discomfort, your doctor may prescribe a conservative approach, such as nasal rinsing or a topical steroid spray, to decrease the swelling and inflammation in and around the doorways to the sinuses and in the nasal passages. It was just a few years ago that patients were directed to have conventional sinus surgery. While it can be useful for some patients, it does not come without causing pain and discomfort.
When the sinuses are blocked and there's nowhere for the sinuses to drain, then we can, traditionally, or the conventional surgery was to go in with instruments that cut and remove tissue and literally create an opening so that those sinuses can drain into the nose. The trouble with those surgeries is that they hurt, they can cause bleeding, and the recovery time is longer. It requires packing so that the bleeding doesn't take place too much. And eventually the biggest trouble with those surgeries is that when we remove tissue, there tends to be scar tissue that grows back and closes up the sinus. And then we have the same problem all over again.
A middle-of-the-road treatment plan now exists for patients who suffer from chronic sinusitis. It's called Balloon Sinuplasty.
The other option now is to dilate that opening from the inside out by putting a wire into the narrow opening and then putting a very strong balloon over that wire right at the side of the opening and dilating that balloon without cutting and tearing and removing tissue so that the sinus opening is bigger without that trauma and the tendency to scar.
Balloon sinuplasty is minimally invasive, safe, and clinically proven.
There's been many studies that have shown that balloon sinuplasty is very effective. The first studies showed that it was safe and it was possible to do, to open up a sinus first in a cadaver and then in a human. And those worked very successfully. Then there were studies that showed that it was safe and there was no injuries to the sinuses or surrounding structures, and the patients did well. Now we have studies that are very strong studies that have many, many patients at many centers across the United States that show that the sinuses remain open at least 2 years, and we suspect longer, and that's actually considerably longer than the studies have shown sinuses being open with other surgeries.
Patients recover quickly and can sometimes be back at work as soon as the next day.
The recovery for a patient, if we do strictly just sinus surgery with the balloon instrumentation, they can go back to their regular activities usually the day after surgery. They can go back to work Usually if their job involves heavy lifting or if they play athletics, then I might ask them to stay off of work or play for a few more days. But regular office work and computer work, you can do that the very next day after surgery. Sometimes though, patients that undergo sinus surgery also have another procedure that's done at the same time. That can lengthen the recovery, but it's really not due to the balloon sinuplasty procedure.
Dr. Zahurullah was the first doctor in the Rockford area to offer the balloon sinuplasty procedure over 3 years ago. He has completed nearly 100 cases, by far the most in the area. Ashley Flanagan of Oregon, Illinois, is one of many patients who have benefited from Dr. Zahurullah's care.
Before my surgery, I had sinus infections all the time. It seemed like every time the weather changed, I would be in pain, sick, uncomfortable, wouldn't want to go do anything or go anywhere. I had my surgery, and if I hadn't had the surgery, by now I should have had a good dozen or so sinus infections, and I haven't had any, none at all. I can breathe better. I don't have the pain and pressure and uncomfortableness. It's just so much better.
Another patient of Dr. Zahurullah's is Courtney Starnes. The level of her discomfort would envelop her and make her unable to do things she likes to do.
Before I came into Dr. Zahurullah, I had chronic sinusitis for about a year and a half, and I had constant headaches, pain above my eye and then in my face, and it hurt even to just, lay on it or whatever. It hurt to lay on it. Work was, sometimes I didn't want to go to work or just work because looking at the computer screen, and I was a little nervous about having surgery, but I figured it wouldn't hurt to try something and have it cured. So I came to Dr. Zahurullah and had the balloon sinuplasty done, and after it I have had no headaches, no pain in the face, and it is all cleared up, and I feel 100% better than I did before.
The balloon sinuplasty system is a proven safe way to relieve your chronic sinusitis. To learn if it's right for you, call the E.N.T department at Rockford Health Physicians at 815-971-2800.